Hello dear friends, this is a case of 86-year-old female patient who presented with significant abdominal pain, right upper quadrant tenderness, Murphy's positive, raised inflammatory markers. She was clammy with fevers, abdominal distension, diarrhea and vomiting, and further evaluation was performed with a CT scan. So let's have a look. Clinically, the patient was suspected for cholecystitis or perforation. So let's have a look. Just keep your eyes in this region, in the right upper quadrant. Okay, so what we see here is that there is some pathology in the gallbladder. I will zoom in and see the details. So here is the gallbladder, the wall of the gallbladder. There are some mural changes. There is pericholecystic fat stranding, but most importantly, there is a mural defect at this point. And probably here as well. And what we can see is that there is encapsulated fluid. This is a subcapsular fluid, as you can see. It is quite homogeneous, and if we track it and follow it, we can see that there is a continuation with the gallbladder and the defects of the gallbladder. So this is almost typical find of Biloma. If we go a little further down, we can see that the collection is inhomogeneous, and there is more prominent fat stranding in this region, and in contact with the right colonic curvature. So let's have a look to the coronal views now. Here is the gallbladder, the site of the perforation, and here is the right colonic curvature, and there are some changes here as well, because there are some secondary inflammatory changes in the colonic wall. Probably this part of the collection is infected. That's why there are some differences between this part and the upper part. So this is a case of a ruptured gallbladder, complicated by a biloma, and a part of it is infected, and a collection and abscess is going to be formed in this region. Another interesting finding is that this is the common bile duct, which shows a degree of dilatation, and there is a filling defect at its lower aspect, which represents a stone. I will zoom in to see it a little better. Here it is. This is a stone. Now, as for the biloma, is an encapsulated intra or extrahepatic collection of bile after biliary tree trauma or post-procedural or traumatic biliary damage. And trauma or post-procedural damage is the most common etiologic causes of bilomas. Just for your information, gallbladder perforation due to acute cholecystitis rarely presents with biloma occurrence. And anyway, the reported overall incidence of biloma is between 0.3 to 2% only, and gallbladder perforation due to acute cholecystitis presents with an incidence of only 2 to 11%. And as you understand, the initial presentation of gallbladder perforation with biloma is extremely rare. Only few cases have been reported in the literature. So this case is very rare case. Once more, the findings. Here is the right colonic curvature, some stranding, fat stranding, part of the infected part of the collection, the ruptured gallbladder, and the subcapsular collection, which is compatible with biloma, as it shows continuation with the ruptured gallbladder. Dear friends, thank you for watching this rare case. If you like my videos, you can consider to subscribe to my channel, and see you soon the next time. Thank you for your time.